Hello everyone, this is third term MBBS student and today I completed my first month of general medicine posting. So now I'm here to share my experience with you guys. Story time! Okay, so just for 1 month back on 6th of October, our second year started. First day of my second year. And from first day itself, we were going to our postings. First day we were little excited that what we will do there, what we will learn there. Everything was so new for us in second year. So yeah, we went. Okay, 10:30 to 11:30 we will have normal classes. Then we have to go to respective OPDs and wards. There we have to see the patients. We have to take history. We have to talk to them. We should learn how to talk to them, and then we have to come back. You should learn Kannada for them. And personally felt it's a bit difficult to learn Kannada so early. Like I only know particular words every day, like I'm using, so I know only few words from Kannada, but I can't speak fluently. So yeah, we used to go in a group. Like we were divided into small units. So we used to go in a group. If the patient knows Malayalam, we'll send one of our friend from Kerala in front to speak. And if the patient is from Karnataka, we'll send one of us friend to speak. And behind we used to like stand, watch, and later my friend used to translate for us. Okay, so that was so boring for us. Like within 2-3 days, we lost our interest. We have to go every day, we have to ask, we have to come back. So, first day we went, we got we spoke to 2-3 patients because we have no idea how to take proper history taking. We went, we took case, and then we came back. And then next day also same thing, we attended the class, same history taking procedures. We went, we spoke to the patient, we came back. Then suddenly the interest came back. How? Because now step by step they were introducing all the systemic clinical examinations. So we have to go, we have to perform on the patient, we have to take history, we have to perform on the patient, and we have to come back. I can share, like, if you can feel, you can feel it. That was like, oh my god, today we are gonna do on patients, like whole first year whatever we learned on physiology practical on dummies and all, we are going to do it on real patients, real life patients. Like we were not excited for doing that physiological process. We were excited to see all the abnormalities which we can't see on our classmate. Okay, because in physiological practicals normally we have to do on our classmates only. So there is everything normal, we have to write normal in reports. This time we were excited, we are gonna see first time the abnormal things. Okay, so doctor used to come, we used to stand with seniors are doing, they are asking us questions, and then doctor are coming, they are watching what we are doing, they are taking they are listening to our history takings and all. And like that our posting was going on smoothly. Suddenly the month was about to end. Okay, 3-4 days back we came to know we are gonna have end posting exams. Like whatever we learned the whole month, now it's time to take a test that what you learned properly or not. Just tell that. Okay, to assess that. We all of us were scared. Okay, all of us non-Kannadigas were scared that how we are gonna manage to speak to the patients and all. So like scary in night we all are gossiping on groups that how we are going to manage. Somehow we have to. And even like for different units, it depends on the teacher what they want to ask. For us it was the whole history taking and whole systemic examination, which obviously we can't do properly because we are just learning, but still he asked us to give a try. Second, uh, only viva type, Third, only case history and general physical examination, like your vitals and all. That's it. So we were scared that only our unit is having whole systemic examination also included. So we were like, how we will manage. But then in last, because we were the third terms, and like they were not allowing us to do in two k groups. They assigned us personal patient, and you have to go, you have to talk, somehow you have to manage. He allowed us to take help from our batchmates, nurses, anyone who can help us. Okay, I went, and I have seen multiple reels on that. Ki when you are going to a patient will tell you some other case histories, and when they are talking to doctors, they will tell some other histories. That happened with me. Okay, I saw the case file. Because that patient was from last 15-16 days, so like I was known to that case little, okay, because we have taken little case history before. So I was known ki bhai, whatever they are giving me in history is wrong, okay, because I have seen her case file. Doctor has written something else. I was so scared, but then I can't say to the doctor that no, my history is wrong like that. Okay, so I wrote honestly whatever they were telling. My friend was there as a translator. She was translating to me and to the patient party, and somehow I was managed to write the case history. Now it's time for blood pressure, then something. Okay, so I don't know, like I'm not sharing any particular information about the patient, but I don't know, maybe after watching this video some people can say that, "Oh, how you can I'm not sure." Okay, but I will try. Okay, so then like my friend went from there. Okay, after completing case history she went. I took the general physical examination. Usme bhi some things I took, because not like she was uncooperative, a bit uncooperative. So I took little things from the examination also, and systemic examination I left completely, because like I can't do properly because she was little uncooperative. Later I had, I guess, 30 minutes again. Their physiotherapy people came, their nursing students came, and I was talking to them like what happened to this patient, like that. Okay, and I was telling that, oh, they are giving me wrong history, what I should do. They are like, you ask to proper nurse, or you ask to proper doctor, they can help you. I was like, I think, but it's an exam, so I can't ask anyone properly. So after that, like I was so like bored there after watching these things. Then I was like, I started talking to other patients. At least two lines I know. I can introduce myself, and I can ask, how are you? Okay, so they were replying me, aram means they are in, like, peacefully they are resting there. But then nothing can be peaceful in hospital, honestly. Like, you think the patient who is lying down whole day there. Okay, let's come back to our topic. Yeah, then the doctor was coming from there to one student, and then he came to me. I'm watching him, he's watching me. I'm supposed to start, because whenever he will come I have to start. I was watching him and he was watching me, and he said something in Kannada. I'm like, sir, should I start? He's like, yeah, that's what I'm saying, you start. Then I started. Suddenly I forgot there, maybe I was nervous or what, I don't remember, but I forgot to tell patients ki informations in a sentence. I just say name, age, like that. Okay, point wise. So he was so nice. He explained me that this thing you have to, he stopped me there, he explained me this thing you have to say in a one line. So I was like, oh, sorry sir, I forgot. He was like, okay, relax, nothing is gonna happen, because you guys are third term, it's okay, first exam, you nervous maybe, so okay, fine. Then I started telling him HOPI, chief complaints, HOPI, everything in the process. Okay, then I skipped 1 or 2 points from HOPI to personal history, like weight loss and some points. So he was ki, "Arey, why you did that there? Why you didn't write it here?" Like that. So he was correcting me. I was happy that, yeah, I did mistakes, at least once, like in 1 month, I tried to talk to a patient and all. Okay, so he told my mistakes. After that, he asked me, do you know what is there was one patch in her hand. I don't know what was that. The patient's bystander told me it's a fistula there. So I was like, oh, fistula, why? Because today morning only we had a class on that, so I can't remember properly the theory. Okay, so, oh, fistula. So doctor asked me, do you know what is this? I said, sir, fistula. He is asking me, who told you? I said, sir, bystanders. He was ki, okay, did you check that? I was like, no, sir. I felt ki if I'll touch that, patient will get pain. So I didn't like touched much. Like I was not bothered about it. So the doctor said, who asked you? Did you ask patient whether it's paining or not? I was like, no, sir. That's your fault, na. You guys came here to learn something, to become a good doctor, no? If you can't do these things, what doctor? Okay, it's like he was telling me nicely only, he was not scolding me. First time I got someone who is not scolding me on this nonsense. Then I was ki, okay sir, sorry sir, from next time I will take care. Again 2 weeks ka posting will come, that time I will take care of this. Then he took out his stethoscope, he put on that fistula. First he heard something, and then he asked me to put his own steth. I was like, oh my god, first time when I use Litman ka steth. And then I was so happy, okay. And he was holding it on the right position for me, diaphragm, the diaphragm. And like I heard the sound something, okay, whooshing, whooshing, whoosh, 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 something. And I was like, I'm so lucky that on my last posting day, I'm able to learn something which others don't know properly. Okay, then the patient was sitting there, and she was little drowsy, and I heard the sound, and then he asked me, is it normal? I was like, no sir, it's little abnormal, like from hand it should not come, like that kind of sound should not come in normal patient. He said, yeah, because it's a fistula. And then he explained me what is fistula. Then he explained me why that sound is coming. Then he said something ki, like in MBBS life, normally people don't see this. You are lucky to see this kind of patient. Then I was like, oh. And honestly, like being a third term student, first posting, I was feeling so lucky that I was like able to see some unique case where like other people from my unit doesn't know about that sound, but I was able to hear it. Like I was feeling I am so lucky that on the last day I'm learning something new. Learning not, but experiencing something new on some patients. I was like, oh my god, I'm so lucky. But you know, I feel even we should like do some experiments, like experiments in the sense in the guidance of doctors, PGs. We should try once. You know, I couldn't take the patient ka BP because I felt that she had a cannula on her here, on her medial side of the arm. So I felt if I'll take BP, I could harm her. So I told this to sir, and then he said me that see, being a student, you have been posted in general medicine, and you are so lucky that patients are allowing you to learn on themselves. So you should take that opportunity and you should try, because you know, honestly, I have never practiced a patient like that, her who is having cannula here. So I was a bit scared. He told me that see, you have been posted here just to fear from yourself, okay, from your inside. I was like, yes, kind of true only na. Like they could have taught that same thing, history taking, by showing a PPT, by like giving some online demos like that. But they allowed us to go there and to like learn something from the patients only, right? So it's like I lost that opportunity. I felt like I lost that opportunity in the first month. But at least from my mistakes, I will learn, and from next surgery ka posting, I will try to improve myself. So yes, from Monday, I'm having surgery ki, uh, what to say, surgery ki postings. Um, yeah. By the way, I was lucky though my patient was known to English. I mean, after taking case history and all from the bystander, I came to know that she knows English and she can talk little English. She can understand little English. I was like, I could have asked her in English only. So whatever, like okay, learn from mistakes. Okay. So like first month of posting was amazing, and I hope in surgery also my interest will be maintained like this only. Like, if once you lost your interest, you can't do anything. I mean, it's difficult to get your interest back. But if you know that every day you are gonna learn something new, then it will maintain your interest, level of interest, and like you will be eager to learn something, at least one point in a day from the patients, and you understood that. Okay, so let's end this video here.